Have you ever brushed your teeth, used mouthwash, chewed a mint, and just an hour later wondered if your breath still smelled bad? You're not imagining it. Every day, millions of people do everything they believe they're supposed to do, yet bad breath keeps coming back. They blame coffee, garlic, age. Sometimes they even blame themselves. But what if the real reason has nothing to do with your toothbrush? What if your mouth has been trying to tell you something, and you've been treating the symptom instead of the cause? Today, I'd like to show you why fresh breath isn't always about brushing harder, and why the answer may surprise you. Hello, I'm Dr. Daniel Brooks. For more than 30 years, I've helped patients solve dental problems that often seem mysterious at first. One conversation happens in my office almost every week. A patient sits down, looks a little embarrassed, and quietly asks, "Doctor, why does my breath still smell even after I brush my teeth?" The good news is, there's almost always a reason. And once you understand where bad breath really comes from, it becomes much easier to deal with. Let's begin with one of the biggest myths. Reason number one, brushing only cleans about half the story. Imagine washing only the outside of your car, while leaving the inside covered in dust and food wrappers. From a distance, the car looks clean, but step inside, and it's a completely different story. That's often what happens inside the mouth. Your toothbrush does an excellent job cleaning the front, back, and chewing surfaces of your teeth, but it doesn't reach everywhere. Plaque loves hiding between teeth, along the gum line, and especially on the tongue. Many people brush perfectly for 2 full minutes, yet skip the places where odor-causing bacteria actually live. And those bacteria keep working all day long. But even if you clean every tooth perfectly, one important surface is still being ignored by millions of people. And surprisingly, it isn't a tooth at all. Reason number two, your tongue may be the biggest source of bad breath. Take a look at your tongue tomorrow morning before brushing. If you notice a white or yellowish coating, you're not looking at leftover toothpaste, you're looking at millions of bacteria, along with tiny food particles and dead cells that naturally collect there. The back of the tongue is especially important. Its rough surface creates countless tiny spaces where bacteria can settle. As they break down proteins from food and saliva, they release sulfur compounds. Those compounds are responsible for the unpleasant odor many people notice. This is why brushing your teeth alone isn't always enough. For many patients, adding a tongue scraper to their daily routine makes a noticeable difference within days, not because it's a miracle tool, but because it removes one of the bacteria's favorite hiding places. Now here's where things become interesting. Sometimes, the problem isn't poor cleaning at all. It's something you can't even feel. Why your breath still smells after brushing. Now here's where things become interesting. Sometimes the problem isn't poor brushing, it isn't your tongue, and it isn't the toothpaste you're using. Sometimes the source is hiding where you can't see it. Reason number three, your gums may be trapping bacteria. Imagine a tiny pocket. Not in your jacket, not in your pants, a tiny pocket between your tooth and your gum. When your gums are healthy, they fit snugly around each tooth. But when inflammation develops, those spaces can become slightly deeper. Food particles, plaque, bacteria. They begin collecting where your toothbrush simply can't reach. As those bacteria feed, they produce gases with a strong sulfur smell. You may brush twice a day, floss regularly, even use mouthwash. Yet the odor keeps returning. Why? Because the bacteria aren't sitting on top of your teeth anymore. They're hiding underneath the gum line. I remember a patient who told me, "Doctor, I've changed toothpaste 5 times this year." The toothpaste wasn't the problem. His gums were. After a professional cleaning and a few small improvements to his daily routine, his breath improved dramatically. Sometimes, fresh breath starts with healthy gums, not a stronger mint. But gums aren't the only place bacteria like to hide. There's another reason I see almost every day, especially in adults over 50. Reason number 4, dry mouth gives bacteria the perfect environment. Have you ever noticed your mouth feels much drier when you wake up or after taking certain medications? That's not just uncomfortable. It changes the entire environment inside your mouth. Saliva is one of nature's best defenses. It washes away food particles, helps control bacteria, neutralizes acids, and protects the tissues inside your mouth. When there isn't enough saliva, bacteria multiply much more easily, and the odor they produce becomes much stronger. Many common medications can contribute to dry mouth. Blood pressure medicine, allergy medications, some antidepressants, certain sleep medications, even natural aging can reduce saliva production in some people. One patient told me, "I drink water all day, but my mouth still feels dry." That wasn't because he wasn't drinking enough. It was one of the side effects of his medication. The solution wasn't simply drinking more water. It involved working with both his physician and his dentist to manage the problem. If your mouth often feels dry, especially at night, it's worth mentioning it during your next dental visit. Sometimes a small change can make a big difference. Now let's talk about something almost everyone has experienced, but very few people connect with bad breath. Reason number 5. Food gets stuck between your teeth. Think back to the last time you ate popcorn, or steak, or chicken. How many tiny pieces stayed behind without you even noticing? Food trapped between teeth becomes the perfect meal for bacteria. Hours later, those bacteria begin breaking it down, and that's when unpleasant odors appear. Brushing alone often can't remove food wedged tightly between teeth. That's exactly why cleaning between your teeth every day is so important. Whether you prefer floss, interdental brushes, or a water flosser, the goal is the same. Remove yesterday's leftovers before bacteria have time to enjoy them. Many patients are surprised how much fresher their mouth feels after adding just 1 extra minute of cleaning between their teeth. Sometimes the smallest habit creates the biggest improvement. Transition to final part. So far, we've uncovered 5 hidden reasons your breath may still smell after brushing, but there are 2 more. One of them has nothing to do with your mouth at all. And the last one is a mistake millions of people make every single morning without realizing it. Why your breath still smells after brushing. We've talked about your tongue, your gums, dry mouth, food trapped between your teeth, but here's something many people never expect to hear. Sometimes the smell isn't coming from your mouth at all. Reason number 6. The problem may not be your teeth. One afternoon, a gentleman came into my office looking frustrated. He smiled and said, "Doctor, I've tried everything. New toothpaste, different mouthwash, tongue scrapers, breath mints. Nothing worked." After examining his mouth, I gave him some unexpected news. His teeth looked healthy, his gums looked healthy. There wasn't enough plaque to explain the odor he was describing. That meant we needed to think beyond his mouth. Persistent bad breath can sometimes be linked to other conditions, chronic sinus infections, postnasal drip, acid reflux, certain digestive problems, even uncontrolled diabetes in some cases. That's why dentists don't just look at teeth, we look at the whole picture. If your dentist tells you your mouth appears healthy, but bad breath continues, don't ignore it. It may be worth discussing the problem with your primary care physician. Sometimes the solution isn't another toothbrush. It's finding the real source. And finally, there's one mistake I see almost every single day. Ironically, people make it because they're trying to have cleaner teeth. Reason number 7, you're cleaning your mouth, but not consistently. Let me ask you something. Do you brush your teeth every morning? Most people do. Now let me ask a different question. Do you clean between your teeth every single day? That's where the answers usually begin to change. Healthy breath isn't created by one perfect brushing session. It's created by small habits repeated every day. Think about watering a plant. You can't forget it for 2 weeks. And then pour on gallons of water all at once. Oral health works much the same way. Brushing twice a day, cleaning between your teeth once a day, cleaning your tongue, staying hydrated, regular dental checkups. None of these habits are dramatic, but together, they make a remarkable difference. The healthiest mouths I've seen over the past 30 years rarely belong to people with expensive products. They belong to people with consistent routines. So, what actually works? If you're struggling with bad breath, here's where I recommend starting. First, brush for 2 full minutes using a soft, bristled toothbrush. Second, clean between your teeth every day. Third, don't forget your tongue. Fourth, drink enough water throughout the day. And finally, keep up with regular dental cleanings and examinations. These simple habits solve the problem for many people because they address the cause, not just the smell. If bad breath continues despite a healthy mouth and good oral hygiene, don't keep guessing. Ask your dentist, and if necessary, your physician. Finding the reason is always better than covering the symptom. Before we finish, I'd like you to try one small experiment. Tonight, after brushing your teeth, clean your tongue. Then floss or use an interdental brush. Only after that, use your mouthwash. Most people do those steps in the opposite order, but mouthwash works best after you've already removed the bacteria it needs to reach. It's a small change. It takes less than a minute, but for many people, it makes a noticeable difference. Bad breath can feel embarrassing. I understand that. Many of my patients avoid talking about it for months, sometimes even years. But here's what I'd like you to remember. Bad breath isn't a personal failure. It's usually a clue that your mouth, or occasionally another part of your body, is asking for attention. And the good news is this: most causes can be identified, many can be treated, and almost all become easier to manage when you don't wait too long. Thank you for spending these few minutes with me. If you enjoy simple, practical advice that helps you protect your smile and better understand your oral health, I'd be honored to have you join me by subscribing to the channel. Until next time, I'm Dr. Daniel Brooks. Take care of your smile, because a healthy mouth is about much more than fresh breath. It's an important part of your overall health.